Okay, welcome to the show. Welcome to another episode on the Gonstead Unfiltered podcast. Today, we got some really cool stuff to talk about, but before we start, I got to start with a story. You know, I always got to start with a story. So, I just got back from Florida. I was in a conference in Florida, a really good conference. And, you know, going from New Mexico to Florida, that's a very long flight. So, I think I had one flight that was about 4 hours, and then we had another one that was about an hour and a half, 2 hours, right? I had to go to Pittsburgh first before going down to the southern part of Florida. So I had a good conversation with this lady who was sitting next to me, and you know, you get to knowing somebody, and they say, well, what do you do for a living, you know? And we get into that small talk, and I said, oh, I'm a chiropractor. And the very first words that came out of her mouth after that was, oh yeah, I tried chiropractic and it didn't work for me. And I can't tell you how many times I've heard that. So I said, well, let me ask you, like, what did you do? And she's like, well, I went a couple times and it just wasn't working. It didn't help. And then I went to a physical therapist, and you know, they were doing some stretches and they were doing all these different things and it didn't help. And I said, well, have you tried anything else? She's like, well, I tried massage, and you know, same thing. It felt good for a little bit, but it didn't help. I said, well, what are you doing now? She's like, well, I'm just taking pills. And so we got into the story of like how many different types of medications she was taking. There were like 5 or 6 different things that she was taking. And I said, well, what's going on? And she was talking about her neck pain and her lower back pain, but then she was also talking about how she was having digestive problems and headaches, and she was having memory issues, and just everything just seemed to be getting worse. And it was getting to the point where just everything in their body hurts. And she didn't really kind of put all these pieces together that literally all, you know, the headaches, the digestive issues, the chronic pain, the pain all over the place. These are all different things that were all one and the same thing, okay? And nobody just got to the root cause. So I said, have you ever thought about maybe doing a lot of that stuff all together? And she was just like, well, why would I do that? They all didn't work. And I'm like, but the thing is, they all work synergistically together. Okay, it's not that any of those therapies are bad. Okay, it's not that chiropractic is bad or physical therapy is bad, or you know, there's even a time and place for medication. Okay, but what most people end up doing is they end up going to one of those therapies thinking that, okay, this is going to fix my problem, only to be disappointed because it doesn't. And then they move on to the next one, and then the next one. And I kid you not, this is how Gonstead Physical Medicine came about. One day what happened was I was sick and tired of seeing patients say, you know what, that last adjustment you gave me was good, but the pain came back. The last adjustment you gave me was good, and it lasted maybe a few days, and then it came back. Oh, well, you know, I tried Dr. Tony, I tried Gonstead, I tried all this, and it didn't work. And it was frustrating when deep down inside I knew that what we were doing was only solving one piece of the puzzle. Anytime you look at somebody who has pain, specifically chronic pain, we're going down this rabbit hole right now with chronic pain, trying to solve that issue. You know, just as a general rule, society as a whole, healthcare as a whole, we're pretty good at solving acute problems, acute pain, people who have an injury and getting them out of pain. But we're really bad at solving chronic pain, people who have had pain for months or years at a time, and not figuring out how to solve that solution. So this took us years, folks, and this is really what makes up the Gonstead difference, is you cannot take one therapy and expect to fix all of your problems. Could you get relief? Of course you could get relief, but you're not going to solve problems. You're not going to solve problems that are long-lasting. You're not going to solve problems that are you know, that eventually stop and you get that piece of your life back that you're looking for. So what we did is we did a deep dive, and I said, you know what, we got to have a solution to this chronic pain issue, because if we don't, no one's going to solve it, and then it's going to lead to this person that I was talking to on the plane, where all they do is they resort to drugs, they resort to medication, they resort to these different things. Now this is how Gonstead Physical Medicine came about. When a patient would come in, and a lot of you can probably relate to this, when a patient comes in, they've seen one provider. This is typically how it goes. They've seen one provider, any healthcare profession, it doesn't matter, okay? That healthcare provider will give them a diagnosis. Maybe they'll start some therapy or some treatment of whatever it is, and it may or may not work. If it doesn't work, then that patient goes on to the next provider, or they get referred to somebody else, and that provider gives them a completely different diagnosis and says, well, you need to try this therapy. They try it, and it may or may not work. And if it doesn't work, then they go on to the next provider, and then the next provider, and then the next provider, and they're driving all over town trying to get different treatments that they are told that they needed, only to be dissatisfied, frustrated, because they're not getting any results. They don't know who to believe because everybody gave a different diagnosis, and the end result is the patient is burnt out from driving everywhere. They're confused because they don't know who to believe, and they ultimately resort to drugs and medications and prescriptions because that's the most convenient thing to do. And then you fall into the trap of modern day healthcare. That's what it is. It's very easy to write a script and say, here you go, get out of my office. I wish my job was that easy. I really do. I wish my job was that easy that all I had to do was just write a prescription for some drug to numb your feelings and send you on your way. But that's not solving problems. That's not putting a dent into society to change the way healthcare is delivered so people don't have to suffer anymore. That's literally our mission statement. And ever since we've come up with a solution to that problem, now what we have to do is expand. We have to duplicate and scale these processes so that way people, not just in one clinic or two clinics, but now they don't have to suffer in a city, in a state, in a region, in a country. That's how you change the way healthcare is delivered. We literally have a 98% success rate in our office. Well, how do you define success? Number one, activities of daily living. Are we returning the patient back to their activities of daily living? Are we restoring movement patterns? Are we improving power, strength, acceleration, range of motion, all of these different things, not just in a joint, but in the entire body? You cannot look at the body as one. If I come in with neck pain, for instance, and somebody's only focusing on my neck, they're missing a significant portion of what's truly causing that pain. So I want to share with you guys this process, this 98% success rate, 4-step proven process. And let me paint this picture for you because this is something that you haven't done before in the past. You may have gone to one provider and done one therapy, or maybe they even did maybe a couple of therapies. But if it doesn't happen in this fashion, in this order, in this sequence, you're not going to see the results that you're looking for. You're not going to get that piece of your life back that you're looking for. It's a 4-step process. Step number 1 is just discovery. That's day 1 for us. If you go into any healthcare provider's office and you're dealing with any type of pain, let's just talk pain, not any other problem but pain anywhere. If they're not doing imaging, if they're not recording you moving, if they're not specifically identifying exactly what could be causing those issues, you're missing pieces of the puzzle. And if you miss pieces of the puzzle, then you start to guess. So let me explain. So on day 1, this is what we do. You come in. We want to know your why. Why here? Why now? Why is this important to you? What are you trying to get back? What piece of your life are you trying to get back? What kind of things do you have to do every single day to function, and not only function, but thrive and be happy with your life? How many times do you see seniors, and on that same plane, on that same flight, it's crazy because every single time I fly probably 20, 30 times a year, right? Somewhere. And you always have the seniors getting on first because they have a hard time walking, they have a disability, they're in wheelchairs, whatever the case is, as should be, okay? As should be. But the problem is we're seeing more and more seniors. And we're seeing more and more people probably in their 40s and 50s and 60s, which I don't, even 60, you're not a senior if you're in your 60s. You're not, okay? And if you're in your 40s, 50s, and 60s, and you're getting on the plane early because of your disability or because you can't walk, and you can't see the problem in that, it's time to wake up. It's time to wake up. There's more and more people getting on planes who can't walk. But why is that? And if I were to have this conversation with the majority of those people, would the same conversation be said about all the drugs and medications and prescriptions that they're on? When do we wake up and say, okay, how did I get to this point? How did I get to the point where I need this cane, I need this walker, I need this knee replacement, I need this hip replacement, I have to take all these pills just to function throughout the day, to alter my chemistry because I'm suffering too much? That's the reality of this. And what makes this so frustrating is that nobody's willing to solve that problem. And yes, it is difficult. Trust me, it's difficult. There's every single day we are challenged with another patient that comes in that has an issue that we need to figure out, that we haven't figured out yet. It's always going to be that way. So what do? We get the answers first. All of those whys. Why now? Why here? Why is this important? All of that stuff. We have to know that information. Because if you're telling me that you're under a sink and you have to bend and twist and do that all day long, we have to treat that differently than the person who's just sitting in a chair looking at a computer all day long. We have to tailor what we're doing to what you do every single day in your life. So that's the first thing. The second thing is we got to take an instrument and we have to run this instrument down your spine and pinpoint exactly where that inflammation is along your spine. And then we have to check the motion of the joint. That joint better be stuck, okay? It's got to be stuck in order for us as chiropractors to work on it or to adjust it, okay? And I'll explain that in just a second here. So we're running this instrument along the spine to pinpoint exactly where the problem is. We're looking visually, what does the skin look like? Are there any blemishes around the area? Is there any red spots or inflammatory areas or petechia is what they call it, or swelling, anything like that? We're looking for all of that from a visual standpoint. Then we're checking the tone and the texture of the tissue around the joints. Is it greasy? Is it a dry spot? Is it hot? Is it cold? What does it feel like? Then we're checking the motion of the joint. Is the joint moving freely or is the joint stuck? And then we're taking a set of x-rays because the x-ray is going to tell us how the bone is positioned. It's going to tell us how much wear and tear is in the joint as far as arthritis or any type of other degenerative issues. And it's the roadmap to tell us how to fix you. If we don't have a roadmap to tell us how to fix you, how are we supposed to fix you without guessing? In any process that is successful, I don't care if it's healthcare or if it's some other business, you better have a proven process in order to be successful. This is our proven process. Whenever I ask other chiropractors or whatever, like, how do you help people? Well, I put them on the table and I adjust them. No x-rays, no motion, palpation. You have them in clothing. So how do you know? Well, you know, I can feel it with my hands. Here's a proven fact, folks. This is proven by research now, okay? You can take 10 chiropractors and you can take 10 people, okay? You blindfold all the chiropractors and have them motion out a joint, okay? So every single chiropractor has to motion out one joint, the same joint. You're gonna get a 30% accuracy on their hands and what they're interpreting. So it can't just be what you feel, is what I'm saying, okay? In the Gonstead system, you have 5 criteria to figure out exactly where the problem is. X-ray, instrumentation, motion palpation, static palpation, and visualization. And we take it one step further because once we get all that information and we say, okay, here are the spots that are not moving. And here's what it looks like on the x-ray. Then what we do is say, okay, you know what? I'm going to record you now in slow motion And I'm going to figure out what areas in your body are not moving and what areas are moving too much. Here's what I want you guys to understand. When you have one area in your body that is not moving, the areas above and below it have to move extra to make up for that loss of motion. Your body is brilliant at compensating and figuring out ways to continue to adapt for survival. Even in surgery, they know that when you fuse two bones together, the areas above the problem and below the problem have to move extra to make up for that loss of motion. And eventually those areas wear down, and then guess what? Eventually those are the areas where surgery is needed because all we did during that time was take pills and medication. This becomes so frustrating. I've been doing this for 21 years now, folks. 21 years. And it's the same thing, only it's getting worse. It's only getting worse. And what's frustrating about that is us as chiropractors, as healthcare providers, are failing at delivering the results and changing the way healthcare is delivered so people, you, don't have to suffer anymore. So literally, we have to record people in slow motion to figure out how they're moving, because I cannot tell you enough. How you move is going to determine how much pain you have. It's going to determine how you're wearing out your joints and how arthritis is developing in your body. It's no different than if the alignment on your car is off, then it's going to wear down your tires faster and unevenly, right? It's no different here, folks. And here's what the research also shows. As a chiropractor, this is the beauty of chiropractic. This is the power of chiropractic. When there's a bone that's stuck, that's truly stuck, it decreases how much sensory information can come up my spinal cord and into my brain so my brain can process that information. If your brain is not processing your external environment and everything that's going on around you, and it's not able to process your internal environment, meaning your blood pressure, your digestion, your breath rate, your breathing rate, anything like that, then all of a sudden you start to develop disease. All of a sudden you develop crisis situations when the body starts to break down and we eventually die. So the beauty with chiropractic is when there's an area in your spine that's stuck, chiropractic is absolutely phenomenal at identifying those areas that are stuck and then unsticking them, making an adjustment, improving the range of motion. And this is what they found in the research, is that immediately after an adjustment, the brain can now increase its sensory processing and receive information and respond to that information significantly faster than before you removed wherever it was stuck. So that when the brain can process information faster, the brain now has the ability to adapt and the body can survive. It's a survival mechanism. But if we can't find these areas that are stuck, even as chiropractors, you have to ask, how do you find the areas in the spine that are stuck? And they better have at least 5 criteria: x-rays, motion palpation, static palpation, visualization, instrumentation. In the Gonstead system, that is a requirement. And when you have that and you do that every single visit, there's times where you're going to get adjusted, and then there's going to be times where we say, you know what? You don't need that area adjusted today. There's no pressure there. The joint's moving. Everything seems to be improving. There's tissue changes for the better. Yeah, let's hold off on that today. How many people are actually going to say that? But here's what happens. You can go to a chiropractor, and here's what they found. If the bone is stuck and you unstick it with the adjustment, the brain's going to pick up and process information better. If the bone is not stuck and it's fine and it's moving fine, and you make an adjustment there, there's no change, there's no difference. You're not going to see anything. And sometimes you actually saw a decrease in how fast the brain can process information. So you better know what you're doing. You better know how the bones are positioned. If there's curves in your spine and you're on the wrong side of that curve and you move it in the wrong direction, you can actually slow how quickly the brain processes sensory information. Huge. It's huge. This is why we call it Discovery Day. Day one is Discovery Day. We want to know everything about you. We got to know everything about you. Why is this important to you? What are you trying to get back? And then we're going to record you in slow motion to figure out what movement patterns are not moving and how the rest of your body is compensating and how is that relating to what we see on the x-ray. And then we're going to do our chiropractic part to figure out exactly where these areas in your spine are stuck. This is how we start to build getting your life back. And then once we're done with all that, we take all that information, we go into our team meeting, and the entire staff, our rehab, massage, naturopathy, chiros, all of that stuff, medical, all of those departments now come together, look at your x-rays, look at your video analysis, get the feedback from the chiropractor who did the exam, and say, what do you guys think? What do you think? What do you think? What do you think? And they go across the board and everybody looks into it and gives their recommendation. This is how you work together and create one opinion, one treatment plan, all done under one roof. This is how you deliver a 98% success rate. And that's just day one. That's just day one. The next step is we get into what we call the revive stage, okay? The first thing you have to do in any circumstance, because 70% of injuries are actually in soft tissue, in connective tissue, fascial tissue. So you have to break up scar tissue first. Imagine having a piece, like a fresh piece of steak that your muscles will feel like. Muscles should feel like a fresh piece of steak. And then that fresh piece of steak turns into like a piece of beef jerky. I kid you not. A fresh piece of steak is soft, it's supple, it's wet, it's hydrated, it's elastic. But as you have traumas, sports, slips, falls, sitting all day, stress, technology, all of these different things, we start to lose water. As we age, we start drying out. Literally, we turn into a piece of beef jerky. So now your connective tissue is no longer soft and supple. It's no longer elastic. It's no longer wet and hydrated. It's hard. It's rigid. It's not elastic. It's like beef jerky. And that's why you see seniors walking around, and when they try to look behind them while driving, their entire body has to turn with their neck because they don't have the ability to rotate their necks anymore. This is huge, folks. You want to give those people their lives back? This is what we're up against. So when we have the 70-year-old who comes into our office and they're all dried out and nobody's addressed where these problems are in their spine, nobody has looked at the roadmap of an x-ray or an MRI or something like that to figure out how these bones are positioned, and they damn for sure haven't recorded them moving to figure out what's moving and what's not and how to assess that from a ratio standpoint. This is why people are suffering. And if they're suffering, now we have problems. So in the revive stage, the first thing we have to do is break up scar tissue and let water get back into the tissue. We have to rehydrate the tissue. Start turning that beef jerky back into a piece of steak. Now here's what happens though in this process, and this is, if there's any doubt in anything that we do, it's the revive stage. I kid you not. And here's why. Because people get sore. This is no different than going to the gym for the first time in a while, and the next day you're like, oh man, I can barely move, I'm so sore. Because you're breaking up scar tissue, folks. You guys ever have those situations where maybe you kind of stretched or moved a certain way, you try to do a certain rehab exercise, and all of a sudden the muscle cramps or it goes into a spasm, and you think that's bad. But imagine taking a piece of beef jerky which hasn't been lengthened and shortened for a long period of time, okay? And all of a sudden you take that piece of tissue and you start to lengthen it and shorten it. Your brain is gonna say, hold on a second, wait a second, let me cramp up, let me go into a spasm and protect this area from further damage. Your brain doesn't know what's going on yet. That's why you get the cramping, that's why you get the spasms. So what we have to do during this process is break up the scar tissue. We do that whether it's through shockwave therapy, we do that through a lot of myofascial release techniques in our rehab department. We do that through nephropathy, which is with our napropaths or with our massage therapists. And even with chiropractic, you're breaking up scar tissue within the joint and the tissues around the joint. So the first really month is designed to break up scar tissue and get water back into that tissue. We call this the soreness stage because patients are sore. You're gonna move in areas that you haven't moved in a very long time. So this is the area where patients typically will experience, I would say, maybe the most doubt because they're like, oh, I'm sore, that's bad. No, that's good. We're moving your bodies in areas that just haven't moved before in a very long time. We got to get that back. We're getting you that piece of your life back. And with anything that is worth living for or functioning for, however you want to say it, there's going to be some level of sacrifice along the way. You guys know that. So this is the first month. We call it Revive. And the reason why is because we're reviving the tissue, getting water back into the tissue, getting you through that soreness stage so that way we can start to restore the tissue. So we had the discovery day, revive. Now step number 3 is restore it. We broke up the scar tissue, we got water back into the tissue. Now we have to either increase the length or elasticity of the tissue and continue to drive water into the tissue. Now this is the cool part, okay, because this is usually around the 2nd month. This is around the time when patients start to say, you know what, I went for a walk, I had no pain. Or I tried to go running and I ran for the first time I've ever, I ran in a long time and it didn't hurt. It was amazing. Or I went to the gym or I played with my kids and I picked up my kids and I didn't have that pain anymore. We are literally creating youth back into your body. This is the exciting part. This is where patients start to buy in. This is where they start to lose that doubt and they start to gain some confidence because they can see kind of the light at the end of the tunnel. This is also a very dangerous point. And the reason why I say it's dangerous is because patients typically feel good at this time and they think they're fixed. But again, during this process, we're recording you moving. If there's certain areas that are still not moving the way it should, then something else is moving more than it should. It's compensating, and eventually, if we don't get to that, it's gonna still break down and it's going to lead to pain down the road. Oh, I went to Gonstead, it didn't work. I went to this chiropractor, it didn't work. It helped a little bit, but it always came back. This is why you can't just look at how you feel with things, but we have to look at how you're functioning. Objective evidence to show there's still a problem. Now, also during this time, we're also doing a ton of red light therapy. We could be doing hyperbaric chambers. All of these different things. We're not just, folks, we're on the precipice. They know that like salamanders can actually regenerate their bodies. Okay? What is it in a salamander that allows them to regenerate their bodies that we haven't figured out as human beings yet? We're made of the same material. What's the difference? Is there a genetic difference? Maybe. Is there an environmental difference? But here's the thing. Here's what we do know. If you take food of some sort, okay? If you take oxygen, if you take light, and you take those 3 things and put them into your body's cells and your body's mitochondria will make energy, water, and carbon dioxide. And as long as you can continue that process with those building blocks like that, your body will start to regenerate. Why is it that kids can regenerate significantly faster than seniors? How many people are spending all their time indoors, avoiding light, meaning the sun? How many people are eating just garbage for food, processed food, chemicals in the food? How many people are not moving at all and increasing their heart rate so they can take in more oxygen? You're missing the building blocks that are allowing your body to regenerate. We're not telling you to take drugs. We're not telling you to take supplements even. Can they help? Maybe to a degree, sure. But that's not what we're talking about here. You don't see salamanders taking supplements or taking anything that, is outside of what nature gives them. But we've become so accustomed to modern day life and processed everything that this is where we're at. So sometimes we can take red light, which is light, a specific light that allows your body's cells to regenerate faster, which is why we take a hyperbaric oxygen chamber to get you that oxygen, not only what your body can take in, but a 60% increase in what normally your body can do. It's like putting your body on steroids with oxygen. So these are the things that we can give you to speed up that healing process. This all happens typically in that second month like that. This is when we're restoring the body. We're bringing the body back to life. And you're excited during this time, which is great. We want you to be excited. We're going to celebrate with you, but we're going to stay on the path because the last stage is the build stage. This is the third month. The build stage is where we're building stability through movement. Remember what I said on day one. What is it that you have to do every single day of your life? Do you have to bend and twist? Do you have to lift? Do you have to walk, run, jump, throw? What do you got to do? And whatever it is that you have to do, then we have to teach you throughout this entire process how to build stability in that specific movement pattern so you can get your life back. So if you say, hey, I used to love running. I can't run anymore. My knees are so bad. My back is so bad. All of this stuff is bad. Then what we're going to do in rehab is we're going to tailor your movement patterns in rehab to walking and running. And we're going to show you how to connect your upper and lower half. We're going to show you how to connect your shoulders to your trunk. We're going to show you how to connect the hips to the pelvis. We're going to show you how to move through 6 dimensions of movement and stabilize yourself in the movement pattern so that way you don't have to keep coming back. And you know how to take care of yourself through this process. We're taking your wish list and turning it into a reality, folks. That's what it is. When we say wish list, you're going to come and tell us on day one what it is that you want. What is it that you want? And at the end of the plan, when everything is said and done, did we deliver on what it is that you wanted to get back in your life? That's how we determine success rates. Now, we do this by training patterns and transitions, like I said, walking, running, jumping, throwing, bending and lifting, getting underneath of sinks, picking up boxes and loading trucks, digging, being on a roof all day, like you name it. The human body can only do so many different types of movements, okay? We all move in the same way. The shoulder was pretty much designed from running and using the arms as levers so that way we can move our trunks, and throwing. So if we're not getting that motion back into a shoulder, for instance, of running and throwing and those movement patterns and those transitions, we're not getting the body back or that piece of that area of the body back to what it's designed to do. It's literally, I don't want to say it's that simple because it's not simple, folks, but you better have a process. This is why when people just go to the chiropractor, wait a minute, did you break up scar tissue? Did you rehydrate the tissue? Did you make it elastic again? And then did you build stability through the movement pattern that you're wanting to get back into? Or did you just do an adjustment? It's the same thing with PT, it's the same thing with medicine, it's the same thing with massage, it's the same thing with acupuncture, it's the same thing with all of them. They're all great therapies. They're all great, but they're way, way better when done together. Here's the problem. There's too many egos that are willing to, there's too many egos in society today that are not willing to drop it and work together as a team. We've done that. And because we've done that, we have a 98% success rate. We are giving people that piece of their life back that they're looking for. And now we have to grow. So folks, I hope you understand the importance of what it takes to get that piece of your life back. I hope you understand that there is a process, a step-by-step process that needs to happen in order for you to get that life back. If you skip any of those steps, your life will be compromised still. There's no shortcuts. There's no shortcuts. I wish I could sugarcoat that for you, but I can't, okay? So if you guys have questions, if you want to know more, always feel free to reach out to us. We always have information, whether it's on our social media, our websites, our podcasts, or anything like that. This is how we go about it. It doesn't matter the condition. It doesn't matter where it's at in your body. It doesn't matter how old you are. Where's the scar tissue? How do we rehydrate it? How do we make it elastic again? And how do we build stability through the movement patterns based on what you want to do? And then where are the problems in your body? What does it look like on the x-rays? How are you moving in slow motion video? What is the quality of your tissue? You put all that together, folks. It is a step-by-step proven plan, 98%. So I hope you guys enjoyed this. If you have any questions, please always feel free to reach out. I love these questions that I get on these podcasts. Please keep them coming. If you guys like this episode, please like it, share it. This is how we get our mission across, not only to this city or this state or this region. We want this across the country. Thank you, folks, and until next time, I'll see you then.